You might wonder why a foot doctor would get interested in alternative.
After more than 35 years as a board-certified podiatrist, Dr. Mitch was well-versed in traditional care. But when chronic pain showed up in his own life, he began to look beyond the usual answers. That search led him to Bowen Therapy, a gentle yet powerful technique that taps into the body's natural ability to heal. Today, through Bowen for Life, Dr. Mitch offers advice to others to find relief, restore balance, and feel whole again from head to toe.
Body and it's all connected. That's part of the problem because Western medicine, is focused on symptoms in an anatomical region, and it doesn't look outside the box. So if your knee hurts, the knee doctor looks at your knee. If your foot hurts, the foot doctor looks at your foot. They don't look at the hips. They don't look at the shoulders. They don't look elsewhere in the body for the origin of the problem. And I got involved in alternative medicine because I was a little bit frustrated that there were people that I gave very perfect cortisone shot. I did a immaculate surgery, prescribed the right drug, I did all the right things, that they still had the pain. And I said, well, it's okay, but I can please 80% of the people 80% of the time. I can't please all the people all the time. And I lived with that for a while, but it's always bugged me a little bit. And so when I had a treatment for my back, I had low back pain for 12 years. And when I had the treatment, not only did my back clear up, but 4 different foot and leg problems cleared up, including hammer toes in my left foot, which straightened out sometime after the procedure was done on me, which is just a massage. Acupressure massage therapy was nothing earth shattering. And when I saw that my hammer toes had flattened out, I said, wait, here's maybe the missing piece to my foot surgery puzzle, because I used to straighten toes surgically and they didn't always stay straight. And I called the gentleman up that did the technique for me and told him what happened. And I said, can you teach me how to do some of these maneuvers to the leg muscles? And I can help my patients with their hammer toes also. And he said, yeah, I can teach you how to, because you really need to learn how to do the total body, where you loosen all of the muscles and all the tendons and change the posture from head to toe. And I said, okay, I'll take you to the workshop and learn how to do it, but I'm not sure I'll do all of that. I'll just probably do the leg muscles. And I thought that was what I was going to do. But it led to much more than that, as I found out as months went by and patients came back to me telling me after the treatment I did that I changed their life. I wouldn't believe what had happened, or they just canceled their surgery for their knee, their carpal tunnel. And so I started studying it more in depth, and I started doing more and more of my patients. And everybody benefited. And also it's started taking care of one of the foot problems that I wasn't previously able to reach. I just had that percentage of people that I can get well, and now I could. A good example of a remarkable result was the very first week that I was doing the Bowen Therapy sessions for my patients as practice sessions. I didn't really know the technique that well. I was doing it the best they could with what I could remember from the weekend class. On Friday, a gentleman came in with a frozen big toe joint, and it had arthritis. It was swollen and red and had a loss of motion, and it was painful. And he said he didn't want a foot surgery because he didn't have time for the disability recovering from surgery, because it takes about 6 weeks. Well, mainly was concerned is about his lower back because he'd been favoring his foot for the last 6 months or so, and now his back hurt. And so he says, "Can you do anything for my back?" And I said, "I'm a foot doctor, but I'm learning this new technique. Come on into my room, and I'll give you a go and over and see if I can give you some relief." And so I gave him a session. And after the session, he came back a week later, and his arthritic toe was all cleared up. The redness was gone, the swelling was gone, the grating and the grinding of the joint was gone, and he was walking normal. His back pain was resolved, and he was a very happy camper. And that was the very first week I was doing it, even though I was not doing it correctly by the manual. The, I was doing the procedures the best I could remember, and I looked at my notebook periodically to see if I was going in the right direction and the right patterns with the movements over the muscles of the tendons. But yeah, I got good results the very first week. And then the second week, the lady came in with a lump or called a fibroma, and it was slightly painful. She, again, another common theme is she's favoring her foot, and she had low back pain. And she said, "I don't care about the foot so much. As long as I know that it's not cancer and it's not anything to worry about, I don't worry. I'm not worried about my foot. Which can you do for my back?" And I said, "I'm a foot doctor. I don't treat backs." And she said, "Can you recommend anything that I can do for my back?" And I said, "I'm learning this new treatment." And I told her a little bit about it. And she said, "Yeah, you want to try that today?" And I said, "Sure." And so I gave her treatment. And she came back a week later. And now that little lump, which was about the size of an almond, was down the size of a pea. And I said, "That's strange." And so I gave her another session. And she came out the third week for another check, another session. And she said, "Is there any connection with that lump on my foot and my stomach?" And I said, "I don't think so. Why?" And she said, "Because when you did that on my leg muscles the first week, I could feel like a gush of worms crawling in my stomach after the treatment." And she said, "Oh, and now look at my like gallbladder and a hiatal hernia pain all got better that night when I went to bed, and I haven't had any pain in my stomach ever since." And look at my foot. Now the foot has got this lump, which was like a almond down to a pea. Now it's like a grain of rice. You can barely feel it. And I said, "Wow." And so I looked at the foot reflexology chart that I had from previous endeavors, and I said, "Oh, that's the liver gallbladder area of the reflexology chart." About 2 years later, I was studying the meridian system, and I remember the patient. So I looked at the meridian. I said, which meridians go up through the inside of the leg and the inner side of the thigh?" And it says liver, spleen, kidney, and the stomach. And so she must have had a blockage in that tissue, which released when the blockage was released, she could feel the gush of energy going into the stomach gallbladder area, which should resolve her problem. I'm guessing, I don't know. But she was able to discontinue her medications and discontinue her gastroendoscope procedures that she was having done every 6 months because she was all better. And I told her, be sure she doesn't tell anybody that I had anything to do with it, because I didn't want to be accused of practicing medicine without a license. And had to be careful because over the years, people started coming with problems without any foot problems, just coming with the headaches and shoulder problems and neck problems and back problems. And so I got a massage certificate so that I can legally do that in addition to my podiatry practice. So I figured it out, but it took a while. And so those are just a couple of noteworthy cases. I've got scads more that I could talk about for a long time, but those are good for now. And then if you like that information, why don't you give me a thumbs up, and there will be more information on my YouTube channel soon.